Hi, I'm Dr. Richard Rogers. I'm a DOT medical examiner here in Phoenix, Arizona. I want to take a few minutes today and teach you how to tell the difference between real urine and fake urine. One of the most common problems that I have as a DOT medical examiner is drivers bringing in synthetic urine. Now, the problem with synthetic urine is they're generally trying to avoid drug detection. So watch the video and I'll show you what to look for. This video obviously is primarily aimed at employers and other DOT medical examiners. I hope you enjoy the video. Leave some comments below if you want. Okay, what we have here are 4 different samples of synthetic urine that was brought into my office over the past several months. Now, the first thing we're going to start with is the color. If you look at the color of this urine, it has a slight green tint to it. You can really see it in this one here, that's a little bit larger volume than the others, but it all has a green tint. Now, this product here is a product called QuickFix. It's sold over the internet, and it is also sold at most marijuana supply stores, places that sell bongs and papers and items, drug paraphernalia. So I think the average cost for one of these is about $30 to $40 per synthetic sample. So you got approximately $120 worth of synthetic urine sitting on the counter. So we talked about the color. That's the first thing that you always want to look for is, does the color look normal? Now, many times the people that are bringing these in, they're smart enough that they'll actually preheat these. And the company that sells these also sells holders that will preheat these things to a body temperature. Okay, so not always is fake urine going to be cold or is it going to be blazing hot. It can actually be a normal temperature. Now, the second thing that you want to look for is, does it bubble? Now, normal human urine, or even any animal, if you shake it, the bubbles will stay. You see what happens there. If I take these and shake it up vigorously, no bubbles. No bubbles again. And for the large one, bubbles dissipate very, very rapidly. Okay, so that is another characteristic of synthetic urine. Now, the next thing that we're going to talk about is something that you can't experience through the video, is the smell. If you take this and if we crack it open, you can't smell this, but a good whiff of this will actually produce a plastic type smell. It will not smell like urine at all. It smells like a synthetic. Just imagine putting your nose into AstroTurf. That's what this smells like. Now, the final thing that I want to go over is when you do your urine dipstick test. Okay, we're going to take a fresh urine dipstick out of here. These are the same things that we use for the DOT medical exam. So I'm going to take one of these. Let's do the middle one here. So I'm going to open this up. And I'm going to stick this in here. And what you're going to see is that nitrates glow very, very bright. So if we take that over here, we can see negative nitrates would be like a beige color, white color, and it's always positive instantly. Okay, so if you see in a urine sample that you stick the dipstick in, it instantly turns that color, I almost guarantee you that it's fake. Now, if you couple the dipstick finding with, so we'll do this one here too, and you can see instantly turns bright pink. All of these will do that. So if you couple that finding there along with the greenish color, the odd plastic smell, if you catch a whiff of it, and the lack of bubble, that's a pretty good indicator that it's fake urine. Now the other thing I want to discuss is the way the drivers come in. Every single one of these samples here had a driver that came in, and that driver said, I gotta go to the bathroom right now. They insist that they have to go right now. They cannot wait. They're ready to go. They're going to urinate themselves if they don't go right now. So they want to skip filling out paperwork. They want to skip everything. They just want to go to the bathroom. And the reason why they want to do that is they were heating these, and they're afraid that it's going to cool off and we will get suspicious. Well, what they don't realize is we're going to be suspicious already, just from that action when they come in. So, keep an eye out for these things. Every one of these drivers that came in, these 4 here, and there's been a lot more than this that have came into my office over the past couple of years. Each one of these drivers lost their ability to drive commercially and had to attend a session with a substance abuse professional and then follow whatever recommendations that the substance abuse professional asked of them. Very costly, very costly. Some of these people lost their jobs and ruined their careers because of this. So keep all this in mind, and keep an eye out for the fake urine, because each one of these people, that was a driver on the road that was doing drugs. All right, have a great day, and if you need anything, just put some comments in the section below and I'll try to get back with you. Otherwise, have a good day.